Good evening, everybody. My name is Brandon Libao. Thank you for attending this speech. Today we're going to be talking about the kidneys, the body's Brita. Okay? So for you guys to better understand the function of the kidneys, we're going to talk about some diseases that are a result of the dysfunction of those kidneys. Diabetes. How many of you folks are diabetic? No? Okay, well, diabetes is the 7th leading cause of death in Hawaii. It affects 1 in 3 people. They're either diabetic or pre-diabetic. Okay. Hypertension. Anybody in here with hypertension? All right, he's got a family history of hypertension. My dad's got hypertension. 304,000 people in Hawaii have chronic hypertension, and about 8% are undiagnosed. So, all right, so let's start with the major topic of today's presentation: the kidneys and their functions. The 4 major functions of the kidneys are the regulation of blood pressure and blood volume, the regulation of blood electrolyte concentration, excretion of metabolic wastes, and conservation of valuable nutrients. Okay. So we're going to work from the outside in. First, let's look at where the kidneys are located in the body. They're right here in the lower to middle torso, between vertebrae T12 and L3. They're retroperitoneal, so they're behind the peritoneum, and the left kidney is slightly higher than the right kidney. Now that we know where it is in the body, let's see how it fits into different organ systems. This is the urinary system. The kidneys are actually the start of the urinary system. It's where all urine production happens. The blood is filtered in the kidney into what is called filtrate. It creates a lot of 180 liters of filtrate. 1 to 2 liters of those become actual urine. So that gives you a sense of how much reabsorption is actually happening inside of the kidneys. Okay. The release of hormones and enzymes, that goes to show the effects it has on the cardiovascular system. The release of erythropoietin, it's actually a hormone. It's released in response to lower blood oxygen levels. Erythropoietin travels to the bone marrow, where it stimulates red blood cell production by binding to proerythroblasts, which then mature further into reticulocytes and eventually erythrocytes, mature erythrocytes in the bloodstream. The release of renin, which is an interesting enzyme. Renin binds to a compound released by the liver, which is called angiotensinogen. Once it binds to that, it cleaves off amino acids until it becomes a decapeptide. That 10 amino acid long chain is called angiotensin 1. Angiotensin 1 meets with another enzyme called angiotensin converting enzyme and becomes angiotensin 2. Angiotensin 2 causes widespread systemic vasoconstriction, which alters blood pressure, brings it up, and also stimulates the release of aldosterone, which kind of helps the kidneys to retain more water and sodium ions. Okay, so here are the major parts of the kidney. We have the sorry, folks. Okay, so we have the hilum. The hilum is the biggest opening. Like I said, we're starting outwards in. Hilum is the big opening for the renal vein and artery, where all the blood supplies come from, and the ureter, where the urine exits the kidneys before going down to the urinary bladder. The renal cortex. This is the most important part of the kidney. This is where the nephrons are, and this is where urine production happens. It slowly moves down the renal medulla and into the minor calyx, major calyx, and out the renal pelvis. Okay. So this is the most important slide I'm going to present today. It's the nephron. It's the smallest functional part of the kidney. We're just going to get started right into it. So this right here is the glomerulus within the renal corpuscle. This is also called Bowman's capsule. So these are, it's actually a network of capillaries through which blood is just pushed through, and it filters out. So it filters out water and other dissolved solutes, and it takes up all this space. After they filter out of there, it goes into the capsular space. Once it's in there, it wants to travel a little bit down to this convoluted area, the real twisty, turny, roller coaster type area. That's called the proximal convoluted tubule. This is where all that 180 liters that go through, this is where the reabsorption of all organic nutrients happen. And it also, that's where some water reabsorption happens. And then we get to the nephron loop. Descending, ascending. Descending is permeable to water. Water goes out, leaves the solutes in, creates a concentration gradient. The concentration gradient then comes to the ascending. Ascending is impermeable to water. Thus, all those solutes are following their gradient. They're going out, and slowly it filtrates, making its way to the distal convoluted tubule, where anything that wasn't filtered here is stuck in right here. So toxins, drugs, all that stuff is out there, and it also selectively takes out sodium ions. Sodium ions, as we all know, water binds to sodium. Water goes out with it. And then the collecting duct and the papillary duct, after all of that reabsorption, it gets through these collecting ducts, and these collecting ducts all come into one big pipe straight out nephron. That's the papillary duct. Okay, this is the, we're just gonna touch on this. The glomerular filtration rate is just to basically what they use to measure how well your kidneys are doing. So it's actually the amount of filtrate your kidneys produce each minute. Okay, major diseases and treatments. We're just gonna touch up on what we talked about earlier. Diabetes is the body's inability to produce or use insulin. The insulin works as a locking key. So insulin's a hormone. It binds to muscle cells, opens the door that lets glucose in. Without functioning, insulin able to function, glucose can't get into the muscle cells. Glucose freely flows, and the blood levels rise. Okay, and so the excess glucose causes damage to these glomeruli. That's these are the capillaries that we talked about that actually do the filtration. Damage to that, it doesn't do proper filtration. Stuff just flies out. Lifestyle changes, insulin injections, and dialysis are treatments for those. Parenteral routes of insulin, even inhaled, works. Hypertension, also, the increased blood pressure damages the glomeruli. It causes these big spaces, and it can no longer filter. Treatments are lifestyle changes. ACE inhibitors and beta blockers, anything that lowers blood pressure, really to help. But once you get to kidney failure, dialysis is the only treatment. Polynephritis, it's an acute thing, usually treated by antibiotics. It's an infection of the kidneys. That inflammation causes the filtration to go down. Kidney function, not top notch, obviously. And this is a quick one on dialysis. A dialysis machine works basically as an external kidney. It's a fake kidney. It filters your blood, puts it right back in for you through a shunt that's placed in the patient. And here are the conclusions of today's presentation. The kidneys are vitally important to all organ systems because of its regulation of electrolytes. They are filters, and these are basically some recommendations. Also, if you have any genetic predispositions to any of the aforementioned diseases, you kind of want to get checked on that, stay on top of it. If you guys have any questions, now would be the time to ask. No? Okay, thank you for watching, and have a pleasant night.
Gee.